Hi everyone, it's Liz with Barrio Performance Therapy, and today we're going to be looking at assessing your horse for pain. We're going to be analyzing our horse's muscular structure to determine if there's any pain or restriction there. We'll be utilizing my cutting horse Rex and my pasture horse Ree, and you'll probably see Alf in the background, my husband's rope horse. He didn't want to be left out. Before we begin today, it's really important to think about safety when administering these techniques looking for pain in our horses. Sometimes when we're looking for pain, we find it, and that can elicit a certain response in our horse. So as you're working with your horse looking for signs of pain or restriction, it's very important to pay attention to their body language. You're going to be looking at things like their eyes, their ears, their tail, their feet, really paying attention to their body language. You know your horse best, but it's important to just look for those signs as you're working through them. A horse that's angry or upset will pin their ears, they may squint their eyes, they may look back at you, they may try to bite, they may try to paw. Another important thing is keeping in mind where your feet are, especially when working with our horse facing toward them. It can be very dangerous to put our feet right in front of them as we're working, because if our horse does paw or even just needs to shift their weight, they can step right on our toes. As much as possible, we want to try to be parallel to our horse, so our feet facing the same direction of theirs, either forward or backwards. These will be important tips to keep in mind as we search for pain in your horse. One of the first things I recommend horse owners do is to assess their horse's posture and preferred stance. So when your horse is standing, how do they prefer to stand? Do they like to stand square, or do they like to have one foot under, one foot out? You can see here Rex likes to stand with his hind left slightly in front, and that's very typical for him. It's difficult for him to stand square. He doesn't prefer that. Now, that's not always an indication that there's some sort of pain or restriction or something terribly wrong with your horse, but it is important to note a horse that has difficulty standing square or does not prefer to stand square may have some sort of restriction going on that's causing that effect. As we go through these techniques to assess your horse for pain, it is important to have them standing relatively square. They don't have to be perfectly square, but we certainly don't want them standing off kilter or canted too much, because that can skew how the muscle structure looks. If a leg is extended out, it can make the muscle look tense. Alternatively, if a leg is tucked, it can make the other side look tense. So it's very important to make sure that our horse is relatively square. There are 4 things that we're going to be looking for when we are assessing our horse for pain or muscular restriction. They are tone, texture, temperament, which we sometimes also call tenderness, and temperature. Between these 4 things, it's going to give us a really good baseline of the muscle health of our horses. And we're going to be utilizing Rex and Ree to see what muscle health looks like. We'll have some good examples of muscle health, and we'll have some poor examples of muscle health. So you can take those ideas and what you see here back to your horse to determine if your horse has hidden muscular pain. Number 1 is tone. We're going to analyze the tone of our horse's muscle using our eyes. Now, ideally, we want the horse's muscle to look smooth and soft throughout the body. Sometimes we have this notion that horses should look muscled. Picture Arnold Schwarzenegger or some sort of bodybuilder that has these really defined muscle lines. That is actually not what we want in a horse. When we see defined muscle lines and you can actually see the outline of the muscle, that's a sign of dysfunction. That is a muscle that has been overused or overworked or overdeveloped. So step number 1 is to take a step back and assess your horse. We're going to be looking for areas of atrophy, so areas that look sunken in or depleted. We're going to look for areas of overdevelopment, so areas that are bulging or look really tight. So for Rex, ignoring his battle wounds from last week, if I take a step back and look at his muscle health, he does look fairly even throughout. I see through his shoulder, it's relatively smooth. Behind his withers, there's a very even amount of muscle. It doesn't concave or dip. There is a little bit of a bump here. It may be difficult to see on camera, but instead of it just being nice and smooth all the way up to his mane, there's a bit of an indent here and a bit of an outdent there. That's something that I'm going to keep in mind as I move further through this process, that I might want to take a second look at that. Additionally, if we look at his hip, you can tell he's very healthy, and he has a nice rounded shape to his hip. There's nothing that's bulging and nothing that's ducking in. So tone is the first thing, eyeballing our horse, and we want to be sure to do this from both sides. So once you've assessed your horse on one side, You'll travel to the other side and do the same thing and compare differences. Maybe on one side you could see a bulging muscle, and on the other side there was a lack of that bulging muscle. Important things to note as we continue our assessment. Now it's time to eyeball Ree. So she actually has squared herself up for me a little bit. She was not standing square, but we'll do the same thing. I'm going to take a step back and analyze the tone of her muscle. So for Ree, she does have a little bit of a defined muscle here through her tricep. It's nothing that's really drastic. It's not like I can see this huge, strong line, but I do notice a little bit of a bulge there. It may be difficult to see on camera. It is very subtle. Additionally, if I look through her hind end, I can see a little bit of a line here and here. So through these muscles, there is a little bit of tension. It doesn't look smooth and flat. So when it comes to the additional steps in our process, when we begin to look at texture, temperament, and temperature, those are areas I want to take a second look at. So we've identified tone. We've analyzed our horse standing relatively square on relatively flat ground. Here, Rex is a little downhill. But we've analyzed tone. We've kind of determined what our horse's muscles look like. Now we're going to look at texture. So what do the muscles feel like? Now, ideally, a muscle should feel like a raw chicken breast. So if you close your eyes and visualize a raw chicken breast and pushing your hands over the top of it, it's pretty smooth. Our hands glide pretty freely. There's no lumps, bumps, grittiness, hopefully not, on that chicken breast. Our horse's muscles should feel the same. So to analyze this, we utilize the tips of our fingers. Some people prefer to use a sharp object for this. You may have seen videos online of chiropractors or other professionals using a sort of a pointy tool to palpate their horse and look for pain. This is not something I recommend. If I took the cap of a pen and ran it down your back, you would move away from it too. That's just not comfortable, and it doesn't give us a true assessment of the muscle health. Instead, we're going to utilize the tips of our fingers. Now, it's really going to depend on your preference if you'd like to use the pads of your 3 middle fingers to run across, if you prefer to use your thumb. However, a thumb is more singular pressure and can elicit sometimes more of a response than is actually there to give. Play around a little bit with you and your horse to decide what works best for you, your body biomechanics, and kind of just what feels right. Now, when it comes to palpating, pressure is really important. And pressure is something that's difficult not only to teach, but also to understand. It takes time to develop a feel for how much pressure to utilize when palpating a horse. My best advice is to use enough pressure to elicit a response if the horse has a response to give. Don't use such little pressure that you're just petting the horse. We don't want to just run our hands along and say, oh, my horse's back is great. They don't react to it at all. But we also don't want to push down so hard that our horse has to move away because it's so uncomfortable. But there's a happy medium in there, and I recommend trying a couple of varying pressures with your horse and seeing what response you get, if any, to determine what's the best fit. So now we're ready to palpate. I like to use the pads of my middle 3 fingers. And to start, we're going to look at the horse's top line. We're going to run our hand along our horse's back. Later on in the video, we are going to show you how to palpate other parts of the horse's body. But for now, we're just going to talk about texture and what to feel for. So I have the pads of my fingers ready. I'm going to run my hand along my horse's back, being very careful to never palpate over bone. So I am not running my hand down the horse's spine. This is not any sort of skeletal work. We are just looking at muscle. So I'm going to find the back of my horse's scapula here, just below the withers. I'm going to come about an inch and a half off of the spine using the pads of my fingers, and with a fair amount of pressure, enough to elicit a response if he has one to give, and a fairly smooth and quick speed, I'm going to run my fingers along his back. Okay, so what am I feeling for? As I run my fingers along his back, I'm feeling for any sort of inconsistencies. Sometimes that feels like gristle. Sometimes it feels like stringiness. Sometimes it feels like lumps. Sometimes it feels like bumps. So it could be that as I run my hand along, I feel something as small as pea-sized gravel, or it could be that I feel something as large as a hard-boiled egg. Muscle can vary very greatly in how it feels underneath your fingertips. So as you move along, you're feeling for all of these things. Ideally, it should feel like that raw chicken breast, nice and smooth throughout. If you feel any lumps, bumps, or grittiness, that is a sign of dysfunction. That means that that muscle is not perfectly healthy and is lacking something that it needs. So there is either overcompensation happening or atrophy happening. Now it's time to move to the next step. So we've analyzed the tone, we've looked at our horse with a fresh set of eyes and determined just what the muscles look like, and we've discussed texture. What do the muscles feel like? Is there any gristle, grit, grunginess, etc.? Now it's time to look at tenderness or temperament. Those are used synonymously in the bodywork world. So just like we did with texture, we're going to palpate, and in this example, we're going to use our horse's top line across their back. And at this time, as I go through, I'm going to be looking for any temperament changes in the muscle or in my horse. So as I run my hands along, I'm looking for signs of my horse ducking out from underneath me, pinning their ears, not at their roommate, but at me. That was good timing, Rex. So I'm looking for any signs of discomfort from that palpation. This is where it's important to be very cautious, paying attention to our horse's body language so that we are not accidentally putting them in a place of pain. If they have a response to give, they will show you. And so that could elicit a response like pinning their ears back, trying to bite, trying to paw, etc. So we've looked at Rex. He didn't really have much of a response to give other than to his roommate behind him. He wasn't too concerned with my palpation. We're going to go look at Ree and see what a difference we may see. I mentioned earlier that Rex is my cutting horse and Ree is my pasture pet, and there's a reason for that. Let's see if you have any ideas as I palpate her back. So just like we did with Rex, I'm going to palpate across her top line using the soft pads of my fingers with enough pressure to elicit a response if she has one to give, and see if you notice anything about the temperament of her muscle as I move my hands across her back. So just like before, I'm going to find the top of the withers, behind the scapula here. This is where I'm going to start, and I'm going to run my hand down her back. Okay, I'm going to do that one more time. Now, did you notice anything about her muscle temperament? As I ran right through this area, she ducked out from underneath me. She may have even given me some eyes or some ears. I wasn't looking back at her head. But as I run through here, well, she's not too grumpy in the front end, but I can tell that this muscle health is not happy. So Ree is suffering from both navicular and likely kissing spine. We haven't had radiographs yet to diagnose it, but she really presents like a kissing spine horse based on this reactivity. Now, if you have this reaction in your horse where they duck away from you through their mid or low back, that doesn't mean your horse has kissing spine. Unfortunately, this is a really common area of dysfunction in horses with poor saddle fit, poor rider balance. Just like our horses, we don't always sit perfectly balanced. We may lean to one side or the other. We may sit back too far. It really depends on your discipline as well. So if your horse has signs of low back pain, don't panic that they immediately, have kissing spine, but it is something that you want to consider and analyze. Does their saddle fit properly? Are you riding them properly? Are they engaging their muscles in a way that allows them to build a strong top line? So this is a great example of a horse that has some dysfunction in the temperament of the muscle as we palpate. She showed me she was not comfortable there. So we've analyzed the tone, what our horses look like, the texture, what the muscles feel like, the temperament, how do the muscles react when we palpate them. Now we're going to look at the temperature. So for this one, instead of using the tips of our fingers, we're going to use the palm of our hand and gently run it across our horse, feeling for temperature differences. We're going to utilize the back in this example again before we start moving to other parts of the body. So with the flat of my hand, I'm just going to gently run my hand across my horse's top line here, feeling for any temperature differences. Ideally, it should feel body temperature warm throughout the whole portion of the muscle that you're testing. That's going to change depending on the season that you're in and depending on what your horse has recently done. So if you just got back from a hand walk or a ride, their muscles will be a little bit warmer because they've been working them. If it's the middle of winter and you just pulled them out of their pen, their muscles will feel a little bit colder. But what we're looking for is inconsistencies. So if it feels body temperature warm throughout, and I get to a portion that feels a little warmer, that's a sign of concern. It is typically an indication of restriction or inflammation in that area. Sometimes it can just be that the muscle has worked recently. But it is important to keep in the back of our minds as we work through, oh, it was warm on this side, that's a little weird. And when we get to the other side to compare, we'll see if it's the same or different. Alternatively, if we're running our hand along and we find a spot that feels cool or cold to the touch, that's an indication of lack of circulation, which is a big red flag in muscle health. Our muscles need circulation to function properly, as do our horses. So if we get to a spot on our horse that feels cold to the touch, it means that muscle is not receiving what it needs, and that is a big sign of dysfunction. So again, using the palm of your hand, you'll gently run across your horse's muscle, whichever muscle you're testing, and feel for inconsistencies in temperature. Now it's time to put everything together. So we are going to do a whole horse assessment using the 4 techniques that we've learned. We're going to be analyzing the tone. What does the muscle look like? We're going to be analyzing the texture. What does the muscle feel like? Analyzing the temperament. How does the muscle react to the palpation? And analyzing the temperature. So we're going to do this on Rex's right side here. We're going to do a whole horse assessment, but it's very important that you do this on both sides of your horse. I have not met a horse yet that is even perfectly across both sides. There will almost always be inconsistencies side to side, and that's what's important for you to know as a horse owner, to have a baseline assessment of your horse, so that when the body worker or chiropractor or vet comes out, you can say, you know, I've noticed that there's been tension in her left shoulder since about March. Or, you know what, I feel like every time I get her out, she wants to stand with that hind right underneath her. These things are so important to know as a horse owner so that you can be informed and know your horse's baseline. So when something changes, you're aware of it. So to begin, we're going to start with our horse's neck. And it is important to know where the horse's skeletal system is here, because we don't want to palpate too hard over bone. So our horse's spine does not go underneath their mane. I think many of us thought this, especially when we were younger, but instead of the spine going here, it actually comes down this way. So as we palpate the neck, we just want to be aware that there are vertebrae underneath this kind of what looks like to be the fatty portion of the neck. There's actually just a very thin muscle here and vertebra underneath it. So first thing I'm going to do is check the tone. So Rex doesn't have too much mane in the way here. We'll move it out of the way so we can see. So we're just going to analyze the tone. Now, we're looking for things like atrophy or overdevelopment, any bulgingness or areas that are lacking. And most horses will have this groove here. This is that jugular groove where the jugular vein goes if we needed to administer an intravenous injection. So that is normal. We're looking for abnormal muscle tone. So for Rex, he's looking pretty good. Now we're going to look at the texture and temperament. So to do this on the horse's neck, we're going to utilize the pads of our fingers again. We're going to be looking for these 2 things at the same time rather than thinking of them as 2 separate steps. And I'm going to cut his neck into 3 portions, not literally, but figuratively. So I'm going to portion it out, starting up here, sort of behind his ear. Again, I do feel the wing of the atlas here, which is one of the first cervical vertebra, so I want to be careful of that. But I'm going to portion it out into the top, the middle, and the bottom, making sort of a triangle shape. So here I go with my palpation. I'm going to utilize the tips of my fingers. I know, Rex, you're a good example, pony. And I'm going to do the top. And he is really tight here. In the beginning of the video, we talked about seeing a little bit of overdevelopment there, and it comes out to play in the texture. So I can feel that this part of his neck is really hard, whereas this part feels nice and chicken breasty. So I've done the top portion. Now I need to do the middle portion and the bottom portion. And he actually did have a bit of a reaction there through the middle. Did you see how he sort of bowed around towards me? There was a bit of a temperament reaction there. So I didn't feel anything texturally different, but he showed me like, something might be a little off there. So I'm going to check it again, and it is okay to palpate multiple times. You just don't want to do it too many times to where you're annoying your horse. So I'm just going to check that middle portion again. And this time he did not have that reaction. So it could have been a false positive, something else was bothering him like a fly, or it could be that he just doesn't have, anything going on there. So for Rex, I know that his muscle health is relatively good through his neck, except for this rhomboid muscle. He's really, really tight there because as I palpated it, I could feel soft, soft, soft. Hard, hard, hard. Now the next thing I would check is temperature, and I would just use the palm of my hand to gently run down his neck, feeling for any inconsistencies in temperature. And his neck is feeling pretty good. Good boy. So that is the neck portion of our assessment. Now we're going to move on to the shoulder and the thoracic sling. Horses have nothing holding their legs to their bodies except for tendon, ligament, and muscle. They have no collarbone, so there is no bone holding this big strong leg to this big strong body except for muscle. Now we're going to assess the health of that group of muscles that we call the thoracic sling by palpating right through here. This one can be a little tricky because the horse, you do want to be cautious of the horse's scapula. So you can kind of just poke around a little bit, feeling for that scapula so you know where it is before you palpate. And then we're also going to want to know where the point of the shoulder is down here. This is the head of the humerus. So I'm going to find the scapula, and I'm going to use the tips of my fingers to push up into the muscle like this. Now, I'm not surprised that it feels nice and smooth, just like a muscle should, chicken breasty, until I get to about here, and it gets really tight. So Rex has quite a bit of restriction through his muscles here. I can see it in the tone. It's a little bulged out there. I can feel it in the texture. And temperament, he's not too reactive to, but you can tell he's not comfortable. Temperature-wise, there's no temperature difference. So it's not necessarily inflamed, but there are muscles here that are not happy. So if I am making my mental checklist, I'm gonna know, okay, there's some little bit of like funk going on here. I might not know exactly what it is, but I know that there's some dysfunction in these muscles. So when I get to the other side, I'm gonna see if it's the same or different. So that's his thoracic sling. So we've done his neck, which we cut into those 3 portions. We did the thoracic sling, which we pushed up in front of the scapula. Now we're going to check our horse's shoulder. This one we're also going to kind of cut into 3 parts. So we're going to find just beneath the withers where the scapula, not ends, but underneath the scapula. So the scapula runs along here. We want to just come right where there is no more scapular cartilage or scapula for us to push on. And we're going to utilize this whole shoulder muscle. And utilizing the tips of our fingers, we're going to push down. We can, of course, first assess the tone of the muscle. Does it look flat? Does it look bumpy? Are there ridges, etc.? So then I'm just going to break it into 3 parts. We're going to do 1 palpation forward, 1 palpation straight down, and 1 palpation back. So just like in the neck, we're kind of breaking it into a triangle shape, and we're feeling for inconsistencies. So his muscle health feels pretty good. There is a little bit of tightness right through the center part. So the middle of his tricep does have a little bit of restriction. Again, I'm going to put that in my mental notes or physical notes if you need to, so that we can compare sides. And so I know if when I check this again next month, does it feel the same or different? Is this just a one-off fluke today, or is this something that could turn into a chronic issue? Then I'll use the flat of my hand to just check for temperature. And temperature feels good, and so does Rex. Now back, we used as our example earlier. So we'll find the spine. We'll come off it at least an inch, maybe 1.5 inches, 2 inches, utilizing the tips of our fingers, and we'll push down the horse's back. And again, the amount of pressure that you use is going to be variable depending on you, depending on your horse. It's really going to be something you learn to develop a feel for, but we want to use as much pressure as needed to elicit a response without forcing a response. So we'll just run our hand along the horse's top line here. And we know how on the back we can also use the flat of our hand to check for temperature. Okay, we've analyzed the back. Now we're going to analyze our horse's girth area. This is an area that you want to use caution with because a lot of horses are reactive here. If they have girths that are over tightened, that are the wrong size for them, or the wrong material, horses can be very reactive here. So I'm going to find kind of my horse's girth area. I'm going to come about halfway between the top of my horse's back and their girth is where I'm going to start. So I'm going to start right about here. Analyzing the tone first, looks good. There's no crazy lumps or bumps or anything that I see visually. So now I can palpate. I can use the tips of my fingers with just enough pressure as needed to come down like this. Okay, so Rex did not have any temperament response. He didn't pin his ears. He swished his tail, but that was, I think, at the flies. And the muscle itself feels fairly healthy, so there's no lumps or bumps or gristle. Now, it is important to note that some horses may have sort of like a pop or a jump response through here. There is a nerve bundle that runs through here, so if you accidentally run over that nerve bundle because you're not totally sure where it is, your horse might have a little bit of a response. So that'd be an opportunity to just do another pass and see if it was truly a muscular response or if you just popped over an area that was like, oh, kind of woke them up and surprised them. So once you've palpated with a fair amount of speed, fair amount of pressure, then you can check temperature with the palm of your hand. And again, about halfway through their barrel here and down. Good, good boy. Okay, so the last thing we need to check is the hind end. There's going to be two pieces of the hind end that we're going to check. We're going to check our horse's glutes, which is just a loose term for this muscle group here that forms the top of the horse's hip or rump. And then we're also going to check our horse's hamstrings, which again is a term for the group of muscles that form the back of the horse's leg and are helpful in propulsion of the horse. So for the gluteal muscles, we are going to first look at the tone. How do they look? Is there bulging? Is there atrophy? Can I see the spine? Is there hollowed areas, etc.? And next I'm going to palpate. To palpate the gluteals, what we're going to do is we're going to find the center line of the horse, and we're going to find the highest point of the horse. So this is going to be the top of the pelvis. So on Rex, it's going to be right about here. Now we also want to find the point of the hip or the tubercocci. So there is a bone here, and this is the edge of the horse's hip, and we're going to palpate between these 2 points. So I've analyzed the tone. Now I'm ready to analyze the texture and the temperament. So to do this, I'm going to use the tips of my fingers and pull down from the top of the hip to the side of the hip. And I'll pull. This is one too where you may want to do a couple passes. You can do one straight down, you can do one to the side, one to the side. There really are, there are rules, but there are no rules. You can do your own assessment of your horse's muscle health, just always being cautious of where bones are. The only thing we don't want to palpate over is bone. So on Rex, it feels pretty good. Oftentimes, horses will have tight gluteal muscles. So as you run your hand along, it'll be, oh, smooth, smooth, and then all of a sudden, bump, bump over the top of a tight band of muscle. So feel for that. And next, we can just check the temperature with the palm of our hand. And temperature feels pretty good. So for the hamstrings, we're going to be analyzing this area next to the tail. You can kind of picture like your horse's butt cheek. So first things first, we'll analyze the tone, and you may have to check both sides for this or stand behind them. Many horses will have a distinct separation of these muscles here, so where the two different muscles start. That's not necessarily a bad thing. This is a very common area to see those two muscle groups come together. We just don't want to see it look really tight or uncomfortable for the horse. So next we're going to analyze the texture and the temperament. So utilizing the tips of our fingers, we're going to find the dock of the tail or the base of the tail, and we're going to run our hand down like this. Now this is another one where sometimes horses will be really sore back here, especially performance horses, barrel horses, rope horses, dressage horses, reiners, cutters. Any horse that's having to utilize their hind end quite a bit will be sore in this area, so use caution. You don't want to accidentally get yourself kicked. But again, we're feeling for any textural differences. Are there lumps, bumps, gristle, etc.? Does our horse move out away from us? And then we will also check the temperature with the palm of our hand. Just gently running down, feeling for temperature changes. Okay, and he feels pretty good. It's really important that you analyze both sides of your horse when doing these techniques. Now you can decide what works best for you. Maybe you want to do neck on the right, neck on the left, shoulder on the right, shoulder on the left. Or maybe you want to do that whole right side and then the whole left side. There's no right or wrong way to do it. The key here is that you are becoming a key player in your horse's health. So what do you do if you find inconsistencies? You find that there is asymmetry. The left shoulder is, man, it is hard as a rock, and the right shoulder is really, really soft. Or, man, when I palpated on my back, my horse just totally ducked out from underneath me. I'm kind of scared to even put my saddle on. I didn't know they were in so much pain. The goal of this exercise is not to nitpick them or tear them apart, but just to familiarize yourself so you know, hey, my horse has a sore low back. I might need to call the saddle fitter out. I might need to call the body worker. I might need to educate myself on how I can do some stretches and massage techniques to loosen that tissue. Utilize all of this to take back to your team of professionals and to have in your mental storage bank so that you can compare it month to month to month. Is the problem that you identified getting better or worse? And these will help you, all of these things will help you have a healthier horse. If you enjoyed this video on assessing your horse's muscle health and you want tools that you can utilize today to help your horse feel better, check out my online course, Equine Massage for Horse Owners. In it, I have a whole variety of techniques for every part of the body to help alleviate restriction, pain, and sensitivity in your horse.